Hello, it's Dr. Rhonda Johnson, and today's Friday, September 3rd, 2021. And today I'm going to be discussing COVID cases in children and teens, a return to in-school learning, and school testing for COVID. Well, the news is not good. More than 500,000 children tested positive for COVID in the United States between August 5th and August 26th, according to the American Academy of Pediatrics. And at least almost 204,000 of these cases were reported in 1 week from August 9th to August 26th. This is an exponential increase in the number of children infected with COVID in August compared to July. Now, with 99% of all U.S. COVID infections being the highly contagious Delta variant, one thing we can assume is that the highly contagious Delta variant is coming to a school or a classroom near you this school year. Now, earlier this year, the CDC revised its playbook for return to K through 12 in-person learning. They provided guidance to schools to safely reopen and remain open for the 2021 school year. And I have previously done a video on this topic. And if you recall, the CDC guidance included multiple layers of recommendation, including that students should try to be socially distanced for at least 3 feet apart. They made recommendations for adequate ventilation, hand hygiene, vaccination of eligible staff and students, and cleaning and disinfecting, and as well as in-school testing. Now, in terms of these layers, many schools serve children under the age of 12 who are not eligible for vaccination at this time, and there are many students and school staff who are eligible for vaccination who remain unvaccinated. And as all of us have heard through watching the news recently, many schools are under the jurisdiction of state governors who don't all agree on mask wearing in schools. Now, I'll digress a little bit to my state of Pennsylvania, where our governor just mandated that effective Tuesday, September 7th, masks must be worn in all pre-K to 12 schools, and students, teachers, and staff will be required to wear masks in all Pennsylvania schools. Now, there are a few limited exceptions to mask mandates, and those are, the exceptions are if it would worsen a medical condition or if it would make a task unsafe, and for student athletes who are playing sports, they don't have to wear a mask while they're playing sports. So I want to next move on to another layer, in-school testing for COVID. Again, one of these layers that can help keep our kids safe in school. Now, in-school COVID testing has been piloted in many states across the United States. In-school testing offers a number of advantages. It's a way to keep kids in school. It reduces disruption to students' learning. It minimizes disruption to working parents who won't have to stay home as much because of frequent school closures. Now, if you've been listening to any of my videos for the past year and a half, you know that I advocate for the prevention of COVID and saving lives. And I have volunteered my time and expertise to do a lot of community outreach and education since the beginning of this pandemic. Now, I do want to disclose that I recently accepted a paid consultant role with Ginkgo Bioworks, one of the vendors who are going to be doing in-school testing across many states in the United States. And I did this because as a pediatrician and public health expert, I truly believe in keeping our kids safe and learning. Many kids lost ground academically. Some kids who need schools as their food safety net missed regular meals last year. Many children lost regular time spent together with their teachers and their friends. And kids missed out on gym classes. We've seen an increase in childhood obesity. Kids missed out on organized sports and music and art lessons. And some kids lacked solid internet access, and this created a gap in their learning. And some kids just simply didn't have a quiet place to sit and learn at home. Now, COVID is here to stay, at least for this school year. And my purpose in doing this message is to help parents and the community understand why I firmly believe that this in-school testing can help our kids stay in school. So here in Pennsylvania, the Pennsylvania Department of Health, using federally funds, is offering to provide COVID testing services at no cost to all K through 12 schools across the Commonwealth, excluding the County of Philadelphia, because they're doing their own in-school COVID testing program for the entire 2021-2022 school year. So how does this work? Well, this in-school COVID testing program is voluntary for both the school and the participants. Schools have the flexibility to determine what type of testing plan they want, their frequency, and the type of test. Now, Ginkgo offers a pool testing option that is easy and simple and doesn't require a lot of time. So I wanted to explain yet another term for your COVID vocabulary that you've picked up in this pandemic. It's called pool testing. What is pool testing? Pool testing is when you collect specimens, in this case, they're nasal swab specimens, from a group. And in this case, the group will be anywhere between 5 to 25 people. And in a school, this can be a classroom, or it can be a sports team, or a choir, for example. Then that pooled sample is then tested for COVID using a polymerase chain reaction. You've heard about this, the PCR test. So how does it work? If the test comes back negative, it means all individuals in that pooled sample can be presumed negative. If the test comes back positive, then everyone in that sample will need to be tested individually to know who is infected. So pool testing is a way to test for asymptomatic infections. If you get a positive pool test, it will require, again, individual testing to quickly identify cases and to conduct contact tracing. Then the infected student or staff will have to quarantine at home until their doctor says it's safe for them to return. Now, for all these testing programs, parents have to opt in, meaning that you have to consent to have your child tested. Now, many parents wonder if their kids will be able to test themselves. Will they be able to use a small Q-tip or cotton tip applicator to test themselves? Well, I can tell you as a pediatrician who's removed a lot of things from children's noses, I think they'll be able to do this. And this will be a small applicator, and it'll be done under supervision. Doesn't require a nurse. And kids as young as kindergarten students can be taught how to do this with supervision. So parents, you may want to find out if your school will be participating in this program. Schools have different packages they can take advantage of. Again, I'm not trying to sell you or market to you, but to introduce this basic concept to this community who listens to my videos. If you have questions, folks, leave me a comment. This is my message for today. As always, my views are my own. Stay safe and have a blessed day.